Welcome back, dental assistants, to Lecture 11, Fixed Prosthodontics. Fixed prosthodontics is the branch of dentistry involved with the restoration or placement of one or more teeth on the dental arch, often referred to as crown or bridge. Direct restorations include amalgam and composite resin restorations that are fabricated in the mouth while the material is soft and adaptable to the tooth. Indirect restorations are fabricated in a dental laboratory from a precise impression or scan taken of that prepared tooth. The tooth must be prepared by the dentist to allow the prosthetic to fit into place with minor adjustments. The completed restoration is cemented, which means bonded and luted into place. Examples of indirect restorations include crowns, inlays, onlays, veneers, and fixed partial dentures or bridges. Now let's discuss types of fixed prosthetic restorations. First, crowns. Full cast crown or full gold crown is made of gold or metal alloy and designed to cover the entire anatomical crown. Porcelain fused to metal crowns or PFM, it's a full metallic coping that is then covered by porcelain or composite material. All ceramic crowns are now the most used crowns in dental offices, and usually it is made up of zirconia or pressed ceramic. Partial crowns can be metallic or porcelain or even composite resin restoration that cover more than 3 surfaces but not the entire tooth. An inlay can be made from gold, alloy, porcelain, or composite resin. They replace the mesial distal, some occlusal and buccal, and even lingual surfaces of posterior teeth, but they do not cover the cusp tips. An onlay can also be made of gold, alloy, porcelain, or composite resin, and they replace the mesial distal, occlusal, buccal, and lingual surfaces of posterior teeth, and they also include the coverage of at least one cusp. Veneers are the thin, tooth-colored restorations covering the facial aspect of anterior and sometimes posterior teeth. Fixed partial dentures are also known as bridges. It is a fixed prosthetic device that is permanently attached to the teeth remaining in the mouth, which can replace one or more missing teeth. The parts of the bridge are the abutment, the tooth or implant serving as an attachment for the fixed partial denture, and the pontic, the artificial tooth or teeth that are suspended from those abutment teeth. Post and core restorations are for endodontically treated teeth. A post is a metallic or resin device that is inserted into an endodontically or root canal treated teeth into that pulp canal and cemented or bonded into place. It aids in the retaining of the final restoration. The core is attached to the post and fills the void that was removed when we remove the dental caries, or from trauma or endodontic access. It also adds strength to that tooth. Dental implants. These are replacements to natural teeth that utilize a titanium metal device embedded into the patient's bone. Osteointegration of an implant is a 3 to 6 month process in which the patient's bone grows around and attaches to that dental implant. The parts of the dental implant include the implant itself, which is that metal device that surgically is placed into the bone. The abutment is the portion of the prosthesis that is inserted into the implant and is the part that accepts that final prosthesis. The care for dental implants is different than regular teeth. You must avoid metal instruments, and the instruments used for scaling should be Teflon-coated plastic. Crown is the final prosthesis that is cemented to that abutment. Polishing should always be done with a rubber cup and gel rather than any abrasive prophy paste.